Hi everyone, this is Dre. I am a healthcare IT consultant and the founder of Draegan Consulting. And on today's video, I would like to continue the conversation about documenting workflows. So I, in particular, would like to talk about two of the common formats that are utilized in the healthcare industry to get those written down. So in the last video, which I will link to below, we talked about what some of the benefits are to having workflows documented and keeping those workflow documents up to date. They are going to serve as foundational elements for a number of other activities and can really be sort of key points to leverage with both operational and project work. So if you didn't have a chance to check out that video, then after you're finished with this one, I highly recommend checking that out and seeing what some of those benefits are. But for now, we'll jump into how to document and where we should start. So workflows, especially if you're at a point where there's not a lot of them documented or they haven't been updated in a while, can be overwhelming. There's an enormous amount of workflows, as you can imagine, in a healthcare environment. So the first way, or the best place to start, I guess, is to identify a section of process that you would like to document and to write down in bullet format in a sequence order what each of the high level steps are. So kind of like a chapter outline in a book, like you're just going to document sort of those key points sequentially, how they happen, a little bit of information about them, who is performing it if you're aware of that, or an indication that there's an interaction at some point. And then as you become more familiar with those detailed steps, you'll find that most people will want to see them represented in a visual format. So having a bullet list that doesn't contain a ton of detail is difficult to conceptualize, and having a bullet list that has all of the detail documented can sometimes be overwhelming and hard to sort of picture and find issues or gaps or opportunities with. So visual formats make that much easier. So there's two main visual formats that are used in healthcare to capture this information. There are certainly more than two that exist in the world, and most definitely these two are not limited to the healthcare industry. So they're used across multiple industries and tend to be common because they are fairly logical and easy to understand. But we will dive into the two that are most common in our environment. So the first one is a flowchart. So I have the definition from Merriam-Webster up here, which is it's a diagram that shows a step-by-step progression through a procedure or system using connection lines and a set of symbols. So the example that I've illustrated here is a patient checking in for an appointment. And you'll see the first step is the patient proceeds to the registration desk to have a conversation with their identification card in hand. Next step, the clerk is going to search for the patients in their system, so whichever computer system that they're utilizing, or if registrations are tracked manually, then they're going to look in their schedule book. Hopefully you're on an IT system, but you never know. And then you'll see a triangle that's illustrated as the third step, and that's a decision point. So that is an indication that the flowchart path can take two different pathways. The one on the right is if the patient was indeed found in the system, and there is a process for matching to make sure that the record that was found is the person that's in front of you. And the second one, they were not found. So that's the process of actually having them entered. And you will see sort of as the flow goes down, they're going to converge again towards the bottom and end as this workflow is exited onto the next one. So as the patient is registered and sort of ready to continue, they'll meet at the bottom, whether they were in the system or not. So this is how a typical flowchart would work. So the second way to document your workflows visually is using a swim lane diagram. So I did look up quite a few definitions of swim lanes in different areas and sources, and the one that I actually liked the best is the one that I found on the Lucid Chart website. So Lucid Chart is a software program that allows you to do swim lane diagrams similar to Visio. I have no relationship with Lucid Chart. I actually don't use Lucid Chart myself, but I'm sure it's great. But I really liked the way they described what a swim lane was. And that's that a diagram is a flowchart that delineates who does what in the process, using the metaphor of lanes in the pool. So it identifies swim lanes of an employee, a work group, a department, a physical resource, and shows connections and communication handoffs between the lanes. It can be used to highlight waste, redundancy, and inefficiency, and for all of those benefits we talked about in the last video. So I put together a very high level, very simplistic swim lane diagram for you to sort of walk through and illustrate what they look like and how they actually represent what occurs. Uh, you tend to see in healthcare the swim lane diagrams going horizontally more than you see the verticals. I haven't actually seen a vertical swim lane in quite a while. I tend to see the horizontal ones used almost exclusively, but I certainly don't want to say there's never a vertical one out there. So the illustration that I've chosen here is a lab test order. So entering a lab test, making a decision to have a lab test done, entering that order and having that lab draw for the patient. So you'll see there's two sort of heavy black bars on the screen. The first one is going to delineate the patient who's on the top in the uppermost left corner from the healthcare staff. So that's the first sort of delineation. So you can see sort of outward facing patient family to inward facing staff member. And then the second hard line that's typically depicted in a healthcare workflow is that of human resources versus systems. So everything below that second line is going to be a computer application or a physical piece of equipment of some sort. So in this case, it's lab instruments and a printer, as well as a computer. So you'll see we're going to start on the left-hand side. The definition indicates you can see the communication points. So those interactions are typically depicted by having two blocks that occur at the same time. So you can see time is going to go from left to right, and things that are sort of up and down on the exact same axis are going to occur simultaneously. So in this case, we have the patient talking to the physician assistant and the physician assistant assessing the patient. So you'll then see sort of as time moves on, the physician assistant will determine that a lab test is required and is going to go ahead and enter that lab order. Simultaneously, the computer system or the software program below the line is actually being interacted with or performing a task and having that process. And that subsequently will go down to the printer, and sort of you get the idea of how the flow works. You'll also see the next sort of connection point with the RN drawing blood from the patient, and you'll see there's a little yellow block in the middle of the page, a little bit off to the right, and that's a policy. So you can also indicate on swim lane diagrams where there's a policy that's involved. You can do those on flow charts as well. That you would depict those with a different image and sort of identify which action and which time and role those are associated with, so where that comes into play. And then you're going to sort of continue along until you get to the end of this flow. Often workflow diagrams that are depicted in swim lane format, they will have sort of a reference point at the end. So they're going to be a continual flow across. So they're going to give you the opportunity to link to the next workflow. Sometimes you'll see them on that bottom right-hand corner where they're going to link to multiples. So just be aware that these are meant to sort of be all linked together and sort of flow very nicely. But that's the overview of what those look like. So defining complex workflows, they tend to be best represented in those swim lane diagrams because you do have the ability to sort of identify where the patient, family, public facing component is very easily. compared to hospital staff or organization staff, as well as your computer systems and your physical assets. So it tends to be easier to see sort of how everything does interrelate. And you can see those in a time and sequence format. But they can be sort of quite overwhelming to just jump straight to that documentation. So one of the things that I've found helpful sort of over the many years I've been doing this is that I would start with a list, sort of get that high level sort of overview outline of this is the sequence I want to talk about, and this is the sequence I want to depict, and then to go in a little bit more detail in the flow chart. So, pull out a little more information and at least delineate those decision points and where they can diverge. They often will become different pages in swim lanes. So to see what that kind of looks like, and then to go ahead and clearly define the actors and timeline sequence it across an actual swim lane diagram. So they can be layered upon each other and rolled up sort of in the same fashion and used to communicate workflow if they need to be communicated to different levels of detail. So you'll often see situations where you've got multiple versions, the swim lane being the most typical detail for complex. So that's all I have for the workflow documentation today. I will have a few more videos on documenting workflows. I just have to sort of figure out how I want to break those up. So they may take a bit, but in the meantime, if you want to check out the website, I've got a bunch of other stuff on there that you might like, and there's some more videos on the way soon. All right, thanks. Have a great day.